You're welcome to the Reproductive Health segment with Dr. Ajayi. My name is Dr. Abayomi Ajayi. We are just going to continue where we stopped last week. We started talking about ART and we looked at some of the factors that affect the success of ART. Now, some of the responses I got was that the success rate appears to be very low. Well, you see, one thing that ART has done, or what IVF has been able to do, is to put in place or to maintain all the quality control system that God has put in creation. That's why all our babies are normal babies. But I'm going to talk about some things, some new inventions that have been done to increase success rate in IVF. So today we're talking about two things. We're talking about blastocyst transfer and we're talking about laser-assisted hatching. These are some of the new things, or the newer things that have been introduced to the field of assisted conception in order to increase the success rate of this procedure. Now, the first thing is the blastocyst transfer. Now, the first IVF pregnancy that I mentioned last week, Louise Brown, was actually through blastocyst transfer because it's believed, some people believe that it's more physiological than either a day 1 or day 2 or day 3 transfer because it's at that stage that the embryo actually attaches to the endometrium. So the blastocyst is the embryo on either day 5 or day 6. And people believe this is about the time, about the stage that the embryo actually attaches to the endometrium. So it's believed that it's more physiological. Yeah, a blastocyst is made up of many cells, about 120 cells. So it's a big chunk of cells. The outer layer becomes the placenta and the inner layer becomes the fetus. And it gives a better picture of the competence of an embryo, you know, because if an embryo can survive outside the body for about five days, it shows that it's likely to be a strong embryo and therefore has a higher chance of implantation. Well, about 50% of transferred blastocysts with implant. So even with blastocyst transfer, you can't take anything for granted. But one thing that we should know while we're doing all this, because I get a lot of requests about people wanting to have a blastocyst transfer. It's not everybody that can have a blastocyst transfer. In fact, about 40% of patients will not get up to blastocyst stage. But it does not mean that they won't get pregnant. Because we know the best place for the embryo to develop is actually inside the uterus. Now, even some people who have had blastocyst transfer fail, and they ask questions. So what are the reasons for failure when you have strong embryo, as it were, in a blastocyst? Because a blastocyst does not rule out the fact that there are chromosomal abnormalities. So one of the reasons for failure is chromosomal abnormalities in blastocyst. And also another cause for failure, the reason for failure, is when the endometrium is poorly developed. So there is still the pregnancy rate for day 3 and day 5 are very, very much in the same neighborhood, though implantation rate is higher in blastocyst transfer. But we recommend this for people who have had repeated failure of IVF, in spite of having good embryos. You know, so many people come to me, they say, oh, the doctor said I had good embryos. I wonder why it still failed. Yes, sometimes we say, okay, when you have had this kind of encounter about 2-3 times, we want to try a blastocyst transfer and see if we can be luckier with that. Now, what are the disadvantages of blastocyst transfer? The thing is that about 10% of embryos will die, which will have progressed if they had been transferred on day 2 or day 3. So it's not everybody who can benefit from an embryo transfer. If in the process of trying to get an embryo transfer, a blastocyst transfer sometimes, you might even not have any embryo transfer at all. And that's why so many clinics have looked at some indices to look for in people who will do blastocyst transfer. And some of these things include the number of embryos on day 3 and then the grade of these embryos and the different parameters that people look at. So in short, it is not everybody. Like I said, up to 40% of patients will not be able to get up to blastocyst stage. One other problem with blastocyst transfer is that if you're thinking of freezing, spare blastocysts, they don't do as well as the 3 embryos that are stored. So those are some of the things that you need to look at before you ask for blastocyst transfer. The other thing that we're looking at today is the issue of laser-assisted hatching. And you know, this also came in as a result of with the fact that some of the patients that are doing this assisted conception are older women. And when we talk about older women, we're talking about women above 37 years. And what laser-assisted hatching does is it involves thinning or making a small hole in the zona pellucida or the covering of the embryo, you know. And this has been shown that by evidence that it improves implantation rate as well. And people went to many extent looking for how to do this laser-assisted hatching. You know, let's just look at it. Imagine the egg of the chicken. And if it's very thick, then it's, if you've ever seen a chicken being hatched before, then it's too tough for the embryo to get out of it. And therefore, some embryos die trying, you know. So, but you can imagine if you have a small hole there, so there's an area of weakness through which it can break through. And that's what laser-assisted hatching is all about. Now, many methods have been used. Chemical methods using very weak acids, mechanical methods using some needles, and then the laser. Now, the most recent thing is the laser. Who are those people that is useful for? Women over 38 years, like I said, in recurrent failure of implantation, when you've had about 3 or more good embryos transferred and they don't seem to be doing well, then you might need to try laser-assisted hatching as well. And then sometimes even your first transfer, your first trial, we see that the zonal pellucida is too thick. That's the covering of the embryo. If we see that it's too thick, then we need to do laser-assisted hatching. Then in women who have increased basal FSH, follicle stimulating hormone, then it's important to do laser-assisted hatching. Then in people who are using cryopreserved embryos, you know, when you are freezing your embryos and you now want to use them, because it's known that the zona, the covering becomes thicker when you store. So it's also recommended for these people. Well, what are the risks of this? Yes, the first, of course, is damage to the embryo. It's possible to damage the embryo. Of course, the risk is very low with laser-assisted hatching because it's controlled. And then people talk about the incidence of small increase incidence of monozygotic twins. So those are the things that, some of the new things that are meant to improve the success rate of IVF. And you can ask for this in any center that you're going to book for treatment. Thank you very much for listening. We'll see you next week.